I'm Nirav Shah, the Director of Maine's Center for Disease Control and Prevention. I'm delighted this afternoon to be joined by Governor Janet Mills, Commissioner Jean Wambrew from Maine's Department of Health and Human Services. Governor Mills, Commissioner Wambrew, and I are happy to be with you to talk about where we are with respect to COVID-19 for the entire state of Maine for today, Tuesday, April 13th, 2021. I'll begin by talking a little bit about the epidemiological situation, a discussion of the recent news from this morning around the Johnson & Johnson vaccine, and then turn things over to Governor Mills before we all take questions from our colleagues in the media. And I begin my portion of the update on another sad note. The Maine CDC has received reports of 2 additional individuals who have died with COVID-19. Both were women aged 80 and over, and both were from Oxford County. Their deaths bring to our total the number of individuals who have died with COVID-19 now to 753 across the state. We'd like to take a moment to offer our deepest condolences to the friends, family members, and communities of both of these individuals. As of this morning, there are now a total of 54,827 cases of COVID-19 across the state. That represents an increase of 571 cases just since yesterday alone. That's a significant increase. I'd like to take a second to just discuss where those numbers come from. As I mentioned last week, Maine CDC is continuing to review and process case reports that have come in, and sometimes case reports that have come in the preceding days. Of those 571 new cases that we are reporting today, not all of them represent cases that were diagnosed and reported in the last 24 hours. Indeed, of those 571, 51 of those cases were from yesterday, April 12th, while 149 were individuals who were diagnosed on April 11th. 166 were individuals from April 10th, and 205 were individuals from April 19th. As I mentioned last week, as Maine CDC continues to review and process cases, we may from time to time have spikes of this nature, where the one-day number of new cases doesn't necessarily reflect what happened within the preceding 24 hours. If and when that happens in the future again, I'll make sure I provide that same type of breakdown. Turning to hospitalizations, where cumulatively 1,742 people have been hospitalized. Right now in Maine, 96 are in the hospital. 36 people are in the critical care unit, and 13 are on a ventilator. In terms of our testing metrics, our positivity rate now in Maine stands at 3.1%. with a testing volume of 671 PCR tests that are being conducted for every 100,000 people in Maine. And finally, to vaccinations. Let's start with the numbers first. Right now, as of this morning, there have been 906,713 shots of COVID-19 vaccine that have been administered across the state. 520,000 of those are first doses, and 386,624 were either second doses of Pfizer or Moderna or the single shot of J&J. To put those numbers in perspective, as of this morning, more than 1 out of every 3 Maine people who are eligible to be vaccinated, that is to say 16 and over, more than 1 in every 3 eligible Maine people have gotten the shots they need to protect them against COVID-19. And 46% have received at least their first dose of COVID-19 vaccine. Let's talk about the recent news around changes to the administration of J&J vaccine. This morning, we learned that the US CDC and the US FDA recommended a pause on the administration of J&J vaccine out of an abundance of caution. This pause came after the detection of 6 cases of a rare severe blood clot called a cerebral venous sinus thrombosis, or a CVST. That type of rare blood clot was seen in combination where individuals also had low levels of platelets after they had received the J&J vaccine. It was this combination of events that caused the US CDC and the US FDA to recommend this pause. All 6 of these cases occurred among women between the ages of 18 to 48 and occurred between 6 and 13 days after they received their dose of J&J vaccine. Of those 6 cases, they are currently evaluating them right now, and I'll talk about that in a moment. But none of those 6 cases occurred in Maine. Now, the reason why this is of note is that the treatment for this type of severe blood clot is different from the treatment of other blood clots. Typically, physicians treat a blood clot using, for example, a type of drug called an anticoagulant, something that thins out the blood. You may have even heard of some of these. One of them is a drug called heparin. But with this type of blood clot, with these CVSTs, that standard treatment using a drug like heparin might actually be dangerous. And patients who might have this type of blood clot may need another type of treatment. Now, tomorrow, an expert advisory committee for the US CDC is meeting to review and analyze the data around these 6 cases. Until that review is complete, the US FDA and the US CDC are recommending a pause. Now, why have federal officials recommended this step? Well, right now, the purpose is to ensure that the healthcare community is aware of this possibility and that they are ready to recognize and treat any instances of this type of clot. We here at the Maine CDC have already notified 2 different groups of people. Early this morning, we notified vaccination sites that were administering the J&J vaccine that they should pause. And just in the last hour, Maine CDC has sent out an email notice, or what's called a health alert, to healthcare providers of all different stripes across the state of Maine to let them know what we know about the situation right now. In addition, Commissioner Wambrew and Governor Mills and I have spoken with our partners at the federal level to make sure we too are keeping on top of the situation and have the latest, most up-to-date information. But I know that this news raises concerns and it raises questions. For many, this is a bump in the road. For example, I've already received a number of questions from folks who have recently got the J&J vaccine, and they want to know what they should do. Let's first acknowledge that for those of you who recently got the J&J vaccine, this isn't what you were planning. But here's what you should do. If you got the J&J vaccine in the last couple of days, it's normal that you will feel some flu-like symptoms. You might have some pain in your arms. You might have a little bit of fatigue. You might have some body aches. What we're talking about today is not that. What we're talking about today is something that happens anywhere from 6 days to 2 weeks after that shot. And so if you are within that window of 6 days to 2 weeks, and you have symptoms such as a severe headache, severe being the operative term. Some people describe it as one of the worst headaches of your life. If you have a severe headache, or things like abdominal pain, shortness of breath, or leg pain, contact your healthcare provider. Now, it's also important to keep in mind, if you just got the J&J vaccine, that what we are talking about today is extremely rare. Again, 6 cases that have been detected across the country out of 6.8 million doses of J&J vaccine that have been administered. That's fewer than 1 in every million. The other thing that's really important to note is that we are not seeing these types of events with the other 2 vaccines that are currently authorized in the United States, that with Pfizer and that with Moderna. We have not seen any reports of these types of blood clots with those vaccines. And that's why I continue to urge folks to sign up for slots with those vaccines. Even though the administration of J&J may be on pause right now, our administration of Pfizer and Moderna vaccine is continuing unabated. And that's why I continue to urge folks to keep signing up for vaccines for Pfizer or Moderna shots as quickly as you can. Again, we are still seeing cases, and that's why getting vaccinated remains one of the best things that you can do right now. So with that, I'd like to turn things over to Governor Mills.
Thank you, Dr. Shah. Thank you for Dr. Thibodeau for participating today. As Dr. Shah noted, this pause, as recommended by the United States FDA and the US CDC, is done out of an abundance of caution following these reports of 6, and only 6 out of 6.8 million cases of a rare and severe type of blood clot from 6 out of 6.8 million recipients of the J&J vaccine somewhere in the United States. Maine CDC, the state of Maine, is not aware of any reports of these effects or these incidents in Maine. In the coming days, the US CDC Scientific Advisory Committee will study the safety data to make a determination on further use of the J&J vaccine. So what does this mean for Maine in the meantime? Well, Maine people have adapted in countless ways throughout the pandemic. Today, we're adapting again. One of the words I've heard most frequently in the last 13 months is pivot. So we pivot today, especially with regard to our mobile vaccination clinic. Yesterday, our mobile vaccination clinic, in a partnership with the Federal Emergency Management Agency, began vaccinating Maine people with the J&J vaccine over in Oxford, Maine. This morning, after we learned about the federal government's recommendation, we advised providers to pause the use of the J&J vaccine. This meant that we had to cancel the appointments for this morning at the mobile vaccination unit outside the Oxford Casino in Oxford, Maine, but not for the afternoon. Thankfully, Maine CDC was able to obtain Moderna vaccine, redirect some vaccine from Maine General Hospital to the mobile vaccination unit, so that all appointments in Oxford at the mobile unit from 1 p.m. today through the end of this week can continue as planned. We'll be working with the people who have been vaccinated at the Oxford site, those vaccinated with Moderna, to schedule appointments for the second doses of Moderna vaccine. That's how we're pivoting. We're also encouraging people whose appointments were canceled this morning at the Oxford unit to call and reschedule them. Call 1-888-445-4111. We'll keep working on this. And of course, there's still some logistical questions that the Maine Department of Health and Human Services and the Maine CDC are working through in the wake of this announcement this morning. For example, our teams in partnership with FEMA are working hard right now so the mobile unit can and will continue its planned route to 10 other towns across Maine, because we are as determined as ever to get shots into the arms of Maine people in the rural and underserved areas of Maine in particular. The mobile unit's next stop will be Windham, starting on Sunday, this coming Sunday. And you can schedule an appointment for a vaccine. You don't have to live in Windham to get a vaccine in Windham by calling the same number, 1-888-445-4111. If you've already got an appointment there at the Windham site, keep it. We're going to give you the right vaccine. And there are also clinics that were scheduled to deliver the J&J vaccine in other places, and Maine people should expect to hear from those providers, those clinics, about rescheduling their appointments to a time when you can get Moderna or Pfizer instead of J&J. For now, I've talked a lot about perseverance over the past several months, past 12, 13 months. And today's another example of it. I am so proud of the great team we have that is so able to respond to issues like this morning's issue with Commissioner Lambrou and Dr. Shah and his team at the CDC. So smart, so flexible, so adaptive. We're undertaking the largest mass vaccination effort in the history of our state and of our nation, and the largest logistical effort made by the state or the nation in generations. Stick with us. Logistical challenges like this one are to be expected. This is why, at the outset of our vaccination effort, we committed to remaining flexible so we can adjust or pivot if and when it's needed. It may take some more time, and it will certainly take some more effort, but it's worth it. And with federal partners like the folks from FEMA and the US CDC, whom I got to meet at the mobile vaccination clinic yesterday, we're going to go great guns into getting shots into arms and continue this effort at the pace we want to continue it at, and make sure the people of Maine remain safe. The COVID-19 vaccines are effective in preventing death and severe illness from this highly contagious disease and from the highly contagious, much more transmissible variants that we're seeing now. And that's why we'll continue in partnership with our federal colleagues and our healthcare providers across the state, so we can put this pandemic behind us once and for all. We'll persevere. We'll continue to pivot and adapt, just as we have all along, to get shots into arms as quickly as we can. I thank all Maine people for their patience, for their commitment to helping us get back to normal as soon as we can. I am so impressed by the fact that already more than a third of the population of Maine, eligible population, have been fully vaccinated. 34.3% fully vaccinated. That's good news. We've got a long ways to go then. Don't let down your guard. Stay safe. Please help us. Be courageous. Persevere. We will get through this together. Thank you. Happy to take questions.
Thank you very much, Governor. The first question for the afternoon goes to Patrick Whittle.
Thank you very much. Wanted to make sure I totally understand what's happening with the MVU, the mobile unit. So it's still on, it's still going to all the planned locations. Is it going to stay on the same schedule that it had been, or is that still a work in progress at this point?
Patrick, it is you got it right. It is still on, still going to the same locations, and it's still sticking with the same schedule that we'd previously announced. Of course, that raises questions, for example, about getting folks their second doses. We're looking at different ideas and options for how we can get folks their second doses if the pause that we're talking about goes on for a longer period of time. If the pause is lifted, then we'll convert it back to J&J. The pause stays for a longer period of time. Right now, we've switched the mobile unit to administering Moderna vaccine, and then we'll work with those who are receiving the Moderna vaccine to make sure they've got the opportunity to get their second dose.
So the plan then is to go to one of the 2-shot options, which must make this more of a logistical challenge. Could you sort of detail that somewhat?
Yep, it is more. There are more logistical considerations that we have to take into account using the 2-shot. There are 2 that I'll speak about, and then Commissioner Lambrou, she and I have discussed this at length today. There are 2 that I'll highlight, Patrick. One is storage. The J&J vaccine, among its strengths, was that it did not require the various types of storage mechanisms. The Moderna vaccine is still easier to use than the Pfizer vaccine, but requires a couple more constraints than the J&J. Fortunately, the mobile unit itself is equipped to store not just J&J vaccine, but also the Moderna vaccine. So that wasn't a major issue for us. We just had to make sure we thought it through. The second is around the scheduling of second doses. Among the benefits, the initial concept of operations with the mobile unit was 1 shot, you're done, and then you go. With the Moderna vaccine, at least for the time being, where we are using it, we've got to make sure that folks for whom we give the Moderna vaccine, we've got to wait for them to get their second shot 28 days later.
I see.
I'll add that we are only 5 hours into the new system. We are working on exactly how people who from 1 o'clock today on going to Oxford Casino site will get their second doses, but we're committed to doing that. As a reminder, you get your second dose of Moderna about 4 weeks later. That gives us a few weeks to figure this out, and we will be in touch with everybody who goes to that Oxford site to make sure that they know how they can get their second dose.
I see. So the state has some pretty big goals coming up for later in May about when capacity caps are going to be raised and things like that. Are those still going to be attainable with if we're looking at a longish pause of the use of the J&J vaccine?
Yes, Patrick, the answer is yes. I will say that less than 6% of all the doses of vaccines, of any kind of vaccines administered in Maine so far to date, less than 6% of them have been the J&J. So we don't expect that big a pause, that big an effect of the pause on our overall supply. We do hope to get an increase in the Moderna and Pfizer vaccines to keep us on track. And we will stay on track. And the restrictions lifting schedule that I announced a month or so ago will remain in effect.
Gotcha. One final thing, and then I'll pass off to the next person. What can the state do to address any issues of hesitancy that this might cause around the state? Because that's been a big part of the national conversation so far.
We're working on public messaging. We have some social media messages going up and as we speak. We're looking to have community leaders, spokespeople, medical people in the field, people who represent the thoughts of the community, speak out and deliver the message to their own communities about how this is so effective in preventing people from getting sick, preventing people from dying of COVID-19. Vaccinations is the be-all and end-all right now. It's what we've got to do. And we need local respected leaders, peer group people in the communities to speak out in whatever method and whatever venue to say why this is so important. I think the more that people are getting vaccinated, the more people getting vaccinated, the less hesitancy you see. I hope that's true. I see it in my own community where people are getting vaccinated. They're feeling a little freer to go out and go to the local store and see people safely. And that feeling resonates. The feeling of freedom you get from being vaccinated, fully vaccinated, it's a great thing. And we want to make sure people understand that and feel that.
Thank you so much.
Thanks, Patrick. Over to Mel Meyer next.
All right, thank you. My question is this: will Maine still be asking for J&J doses during the next week allotment?
Mel, we've been informed by the US CDC and our colleagues at the White House that there will not be ordering by states of J&J vaccine for the upcoming week. If that ordering were to become available tomorrow, later this week, whenever that will be, we will absolutely be ordering up to our allotment. But from what I've been told and what the governor and commissioner have been told, for next week, there is not a planned delivery of J&J vaccine.
My second question then is, places like Washington, Somerset, and Aroostook counties have had the biggest benefit because of the J&J doses. How could this impact those areas, and how do you plan on compensating for that?
I think the towns the mobile unit is headed to, and still, as far as we're concerned, still on schedule to go to, include Biddeford, Wyndham, Freiburg, Turner, Waterville, Old Town, Millbridge, Calais, Madawaska, Auburn. In addition to the, I'd say estimated nearly 200 other vaccination sites across the state, including every pharmacy, every major pharmacy, Hannaford's and Shaw's and other places, and the FQHCs and the large hospital systems. So there are a great number of vaccination sites now, in addition to the mobile unit. But we want to get it out to every corner of the state as quickly as possible.
And then, I'm sorry, my last question is just, we've already received those J&J doses. Can those be held on to for future use? Should they be given the all clear?
Absolutely, Mel. It's a great question. What we have indicated to providers is this is just a pause. This is not a chucking the doses out the window or anything. It's just a pause until more can be understood about these 6 cases, whether there are other cases out there, and then so that more providers can be briefed on what's happening. So that if they have a patient who has these signs and symptoms, they know how to evaluate it. They know not to use the classical treatment for other clots, but to use a different alternative. That's really what's going on here. So we have instructed providers not to throw out or otherwise dispose of the J&J doses, pending additional information and recommendations from the CDC and FDA.
And it has a pretty long storage duration, storage capacity too, right?
That's correct. That's correct. Given the pace that Maine has achieved with vaccination, the doses that we got this week, the 2,500 doses, we anticipate that who knows how long the pause will last, but I'm not too worried about them spoiling on the shelves.
Okay, thank you very much.
Thanks, Mel. Over to Joe Lawler next.
Yes, hi, thanks. Just one request and then some questions. Just you were mentioning the public health messaging that went out to providers. I'm hoping that the Maine CDC can share that publicly.
It's already on our website, Joe.
Okay, thank you. So the doses that J&J doses that you received last week, the 20,600, have those all already, or most of them, have they already been put into arms, or are some of those still waiting to be used?
I'll have to check with our immunization team to pull the inventory on hand versus inventory delivered. I know that a lot of them were used, and we've seen that as evidenced by the numbers that we achieved. But to your exact question, Joe, I'll have to check with our immunization team to get you a sense of what percentage have been used already.
Okay, and then I'm wondering what you think about, there's been a lot of discussion about trade-offs. The decision by the FDA and the US CDC to do this pause for the reasons you mentioned, and then the trade-off is that there might be some, it might increase some hesitancy amongst the public willingness to accept the vaccines. What do you think those trade-offs are real? And do you think this was the right way for the FDA and the US CDC to investigate the 6 cases?
I'll start, but invite others to weigh in. Joe, to be completely straight with you, this news, I myself only learned about it at about 7:25 this morning. So we're at hour 7 right now. I don't really, I'm awaiting the discussion at tomorrow's advisory committee meeting tomorrow afternoon, so I can get a better sense of the scope and magnitude of what's happening, as well as what's understood clinically about this type of clot. For me, Joe, personally speaking only, I haven't formed an opinion of that trade-off and whether this was too early, too late, or just right. For me, again, I need some more facts.
And let me say, I had a conversation with Dr. Fauci and others this morning, and I'm pretty sure Dr. Shah's had conversations of a similar sort today with his sources in the White House, in and around the White House. And Dr. Fauci was clear. The reason for this pause is to make sure physicians, in some very rare cases, do not inappropriately treat someone with heparin, and do not inadvertently make a mistake in therapy. And they want to give the FDA and the CDC time to determine if there are any more cases anywhere. And given the very, very small numbers, he was pretty clear, 6 out of 6.85 million, 1 in a million, basically. But he said, compare that to 31 million people in the United States who have gotten COVID. 31 million out of 331 people, Americans, or 1 in every 10 Americans who's gotten COVID. 1 in every 58 Americans who's died with COVID. Compare that, do that risk analysis. You're going to get the vaccine, a vaccine. There should be no reason for hesitancy because of this blip.
Joe, the other thing that I think is really important to note is We have a system out there that looks for events like these and encourages reports of events. And those reports are investigated and taken seriously by disease detectives at the US CDC and experts at the US FDA. This is the way our system maintains safety. And this is the way our system lets doctors know what's out there. And this is the way our system lets all of us know what the various risks are of any drug. So on one hand, this is a speed bump. It's a bummer, but it's also the way our system understands what's going on out there, pauses, evaluates it, and gets information back out there. That's something that, to me, actually inspires a little bit of confidence, even though the news today is not what any of us wanted to hear.
If I could squeeze one last very quick question. Out of the 906,713 doses administered in the state of Maine, are you aware of any adverse reactions beyond the normal typical reactions, side effects, et cetera?
We are not, Joe. For J&J, as well as for the Pfizer and Moderna vaccines, although there have been reports of the anaphylaxis and other such things, we are not aware of anything of this nature, such as blood clots or anything otherwise out of the ordinary from what was reported in the clinical trials. Let me turn it over to Megan at WMTW next.
Dr. Shaw, for taking my question. Start with this. The blood clot disorder, the rare disorder that you're seeing from the J&J vaccine, is it similar or the same as the one as reported as a side effect of the AstraZeneca vaccine that they were using in Europe?
Thanks for that question, Megan. It seems to be of a similar type of strand. Now, they are different vaccines. They operate a little bit differently. They use different types of structures. But based on what I've been briefed on, what we are seeing with the J&J, these 6 reports, seems to be medically similar to what has been observed in Europe in connection with the AstraZeneca. Their numbers seem to be higher in Europe in connection with AstraZeneca, but it seems to be somewhat related.
This is a huge question, but is there any way that you can make a correlation like what that tells us? Does that tell us anything?
Too early to say, Megan. Yeah. There have been some scientific papers, or one scientific paper published in the preeminent medical journal, the New England Journal of Medicine, that suggested some possible pathways between why a vaccine of this sort, or in this case, the AstraZeneca vaccine, might cause individuals to have low platelets, which then might lead to clumping or a blood clot. But it is really too early to tell. That's one reason I'm pleased that the CDC has called for their expert advisory committee to come together tomorrow, study and evaluate these data and understand them better so they can then put out information to clinicians.
My final question really has to do with anybody receiving a vaccine coming up. So I know that the governor, Governor Mills, you had mentioned that we were redirecting some of the Moderna vaccine from Maine General to fill the void, I guess, left by the J&J vaccine. Does that mean people who are scheduled for the Moderna vaccine, are we taking from one place and giving to another? So let's say you're not getting the J&J vaccine. Let's say you're getting another vaccine. Should you then be concerned that your appointment might be canceled?
I think the answer is no, but perhaps Jean or Nirav could answer that better than I.
I'll take a start. We work hard, as we have since the very first part of our vaccination effort, to look at the allocation, who gets it, see if there's doses that are not scheduled to be administered, and we move them. This is not, this is something we do every single week. We're going to do it this week. We're going to do it next week with the change. It is partly because some provider may have overestimated the demand in an area. It may be that there just aren't enough people to administer the vaccines in certain circumstances. So there's many valid reasons why a particular vaccine clinic may have extra doses on hand. And we have from the start moved doses where we've had a mismatch of supply and demand. We're doing that this week. We will do that next week again. Will this slow things down? Probably. When we have less doses, we have less shots in arms. All that said, we have heard, as Governor Mills said, that we'll get more Moderna and more Pfizer next week, we're hoping that keeps us on track. We are not asking any clinic to cancel appointments with Moderna or Pfizer in order to make up for the J&J vaccine, but we are going to do our best to find those extra doses and move them to sites that can use them, as we have done since the start.
Thanks, Megan. Over to Chris Costa next.
Hi, everybody. I think you guys may have answered a lot of these questions already. So, and please pardon me for a little bit of medical ignorance when I ask this next question. This type of clotting, the CVST, is this something that a person would be aware of? Would a doctor have already told them you might be susceptible to this? And would they know that as part of their own medical history before getting, potentially a Johnson & Johnson shot?
Okay, two somewhat related questions there, Chris. The first is, would someone know that they might be at a higher risk for this type of clot? And the answer is probably not. Based on the 6 cases and the initial review that have been done on them, the deep dive review is tomorrow. But based on that initial review, there wasn't one common element that stood out, that they also had all the same additional medical condition, or were all taking a similar type of drug, for example. So this doesn't seem to be something that can be predicted. Based on what I know right now, again, the expert advisory committee is meeting tomorrow. The second element of your question, Chris, is would someone know if this was happening to them? And the answer there is yes. The symptoms of a clot like this are severe. A severe headache, severe abdominal pain, severe leg pain, or very severe, out of ordinary shortness of breath. So this is not something that is mild. It's considered to be something very severe, such that you would know that something was wrong and you would know to call your doctor.
Gotcha. And Commissioner Lambert, I know you actually just addressed this moments ago about if we're expecting to see sort of a slowdown of the rollout. Do we anticipate that a lot of people who had been scheduled for J&J appointments at our retail pharmacies and our clinics across the state, I believe it totals, as far as the doses we had, was about 5,100 doses of J&J for this week. So are we expecting that people will start to pivot their appointments to the other manufacturers, the Pfizer and Moderna? And how do you think that that's going to affect how quickly we can get shots into arms and therefore also the availability of appointments?
And just a quick numbers check. For this week, week 18 of the vaccine distribution, the state of Maine was only able to distribute 2,500 Johnson & Johnson doses, and that is because of a scheduled slowdown in the J&J distribution. Of those 2,500 doses, 2,200 were dedicated to the mobile vaccine unit, and those are the ones that we just discussed that we're going to be using some Moderna vaccine to replace. We've also contacted the other organizations that got those J&J doses to make sure that they knew about the new guidance on the pause. All that said, we do know that when you get no or lower doses, that does potentially limit your ability to get shots in arms, which is why we're hopeful that the Pfizer and Moderna vaccine doses that are going to be coming to Maine next week are larger than they were this week. We're going to continue to tap into our retail pharmacy programs, our FQHCs, our long-term care pharmacy programs who are getting federal supply separate from the state allocation. And as Governor Mills has said, we're going to roll up our sleeves. We're going to do what we've done in the past, which is make the best and persevere.
Okay. And Dr. Shah, one last quick question about cases instead of vaccines. We're starting to see the daily cases. I understand you've explained kind of the context with which we see the cases come in. Do we know what's causing this? And I guess, given that we're not getting sort of the 24-hour reporting, what are you seeing for trends in terms of cases? Are we going up? Are we going down? Are there outbreaks that are causing this, what appear to be a rise? Again, I know it's a little bit confusing with kind of the way things have to be reported right now. Can you help us walk through that?
Yep, sure, Chris. And I appreciate your recognition that this increase in cases is not necessarily all cases in the last 24 hours. Indeed, only 51 of the cases we reported today were individuals who got their lab reports in the last 24 hours. There's a number of things going on, Chris, and this is based not just in Maine, but in my conversations with counterparts and colleagues across New England. Some of the increases being driven by the spread of variants, particularly in this part of the country, the B117 variant, as well as another variant that was first characterized out of New York. both of those variants, at a very minimum, are more contagious. The scientists are still debating and studying whether they're more serious as well, but they're certainly more contagious. That's one thing that's happening. The other thing is that we've seen some of those variants cause more outbreaks. Those outbreaks, of course, generate more cases ongoing. But what I think has been notable recently and of concern is that we've also seen an increase in hospitalizations just in the past couple of days. The average age of individuals who have been hospitalized has come down, as has the average age of cases in Maine. Just a couple of months ago, the average age of new cases in Maine for COVID-19 was about 43. Now it's down to about 35. So we're seeing all of these shifts happen, partly because of who we're vaccinating, but unfortunately, we're still seeing folks being hospitalized at now increasing numbers. That's really one area of concern right now.
Thank you.
Let me turn it over to Charlie at Maine Public next.
Yeah, hi, Dr. Shaw and Governor Mills and Commissioner Lambrew. Thanks. So I guess I think I have two clarifying questions. One is about the Moderna doses that were switched over to the mobile clinic. So, well, specifically, so are you, is it the case that Maine General had basically unfilled appointments for Moderna doses and that allowed that supply to be shifted to the mobile clinic?
No, it wasn't that they necessarily had unfilled. They did have some, but they also had vials that were slated. So they were vials that could be used as second doses that we can shift over as first doses and then replenish it as soon as we get our next shipment of Moderna.
Okay. And again, you said currently no clinics have been advised to cancel or reschedule any previously made appointments. Is that right?
For Moderna and Pfizer.
For Moderna, Pfizer, right? Yeah. And then I think Commissioner Lambrew mentioned that of the 25 J&J doses that came, 2,200 were slated for the mobile clinic, and then there were 300 more. So where did those 300 go? And do you know if there were any other J&J doses through the separate provisions to pharmacies and FQHCs?
There always are. So just talking about the state allocation, we did this week have some go to our public health nurses because we were going to be doing a special clinic on one of the islands. We continue to work with the Department of Corrections to vaccinate incarcerated individuals. We spoke with them this morning to make sure that they knew about the pause and were holding for now. And we also sent 100 to the Holden Band of Maliseet Health and Wellness Center. And again, we communicated with them of this pause. And what we'll be doing is working with each of these organizations, plus some that may have gotten doses last week. They were planning on using them for clinics this week to see, are there alternatives? Are there ways that we could continue the appointments for the J&J vaccine using Moderna or Pfizer where possible? Now, while we are not asking clinics to cancel their Pfizer and Moderna appointments that are already booked to reallocate for people who might have a J&J vaccine appointment canceled, there will be some places that cancel their Johnson & Johnson vaccine appointments and won't be able to find an alternative. And we urge those individuals to go to our website, call our 1-888 number, and see if you can find a different appointment at a different site. In other words, for anybody who is affected by the J&J pause, we do urge you to look around, find other sites, and feel free to call our 1-888-445-4111 number. And Governor Mills should correct me if I got that wrong, to make sure that you see if there are other appointments available, because you may be able to find one that's convenient and timely for you as well.
Okay, great. And then I think just my other question is sort of related, since the J&J was trumpeted as a way to, get vaccines, say, to homeless people living with homelessness or other vulnerable populations. Are you concerned in general about how you'll be able to reach those groups going forward in light of this holdup?
Charlie, I think it depends on how long this pause lasts. As Governor Mills noted, based on what we've been briefed out on, the initial impetus behind the pause was to organize, inform, and educate healthcare providers as well as the general public about what's going on. So healthcare providers can be on the lookout for these symptoms and know to treat it this way as opposed to the standard way using heparin. So that's what we've been briefed out on. Let's see what tomorrow's scientific review reveals as well. But certainly, if this pause goes on for a longer period of time, who knows how long that might be, the concerns you raised will come into sharper focus, and we'll have to come up with an alternative mechanism to keep vaccinating vulnerable populations, whether it's people who are experiencing homelessness, those who live in harder to reach areas. Our motto since day one has been, we'll get it done. And so the entire pandemic has been a series of unending challenges. We'll get it done.
Okay, thanks so much.
Over to Amy Brown next.
Thank you, Dr. Shah, and Governor Mills, and Commissioner Lambrew. Can one of you talk about how Maine tracks any reports of health issues that people think might be associated with the vaccine once they've had them, and then how that is verified to see if there's a causal relationship?
Tracking for any potential adverse event related to vaccine is done via a federal platform. It goes by the acronym VAERS, VAERS, stands for the Vaccine Adverse Event Reporting System. And that's a system that's managed by the US CDC with an assist from the US FDA. And individuals and healthcare providers can make reports into that system. And depending on what those reports indicate, they are then followed up by epidemiologists or investigators from either the CDC or FDA or another group that helps out to go into a deeper medical dive. We at the state level take a look at those reports as well. They're open, and then that helps us get a sense of what's going on within our state as well.
Okay, great. That's just that one website that's pretty much open to the public. People can search on that. Okay.
That's correct.
You've mentioned that this type of clot can't be treated with heparin. How is it treated? Is there a treatment for it?
Yeah, there are different types of treatments that hematologists and those who specialize in types of clotting disorders can use. So it is something that's treatable. But again, I think what the CDC and FDA wanted to do was make sure that they were basing all of those treatment recommendations on what we know right now. So that's the reason, I think, behind the pause, based on what I've been briefed, certainly the reason for convening the expert advisory committee tomorrow.
Okay, just one more quick one. A listener wonders if the state is keeping track of the number of people who test positive after they've been fully vaccinated.
We do keep track of those cases. They are called what are known as breakthrough cases. We do keep track of those, and at the US CDC's recommendation, report those numbers up to them.
And do you have a sense of, do you know right off the top of your head how many of those we've seen in Maine?
As of last week, when I met with the team that reviews breakthrough cases, and this is, again, as of last week, Amy, that number stood at 64. It has certainly, the team is always receiving reports, vetting them to make sure, for example, the case was diagnosed after 14 days following the final dose of second vaccine, so on and so forth. So that number may be higher now, but as of late last week, it stood at 64.
And do you know if any of those folks have had anything more than a mild case?
Based on our review last week, they had not. That's a good point. Most individuals who have these so-called breakthrough cases, many of them have reported mild symptoms. Several of them didn't even know that they had COVID at all. It's proof positive of how effective the vaccine is.
Great, thank you.
Over to Bonnie at the Sun Journal.
Thank you. St. Mary's Hospital in Lewiston was planning to do a short-term clinic, but a pretty good size one, over 2,000 shots in April vacation. And I think they were going to use a J&J, and they're not sure now where that stands. Do you know if they'll be able to continue, to hold that clinic April vacation?
Bonnie, it really depends on when and how this pause and the analysis underlying it is resolved. It also depends on what the supply of J&J vaccine is. This current week, as Commissioner Lambrew has noted, as a state for our allocation, we only received 2,500 doses. Next week, the allocation of J&J was not thought to be that much higher, if it was even higher at all. So some of it depends on this new information that's 7.5 hours old around the pause, but even holding that in abeyance, some of it also depends on the supply of J&J overall.
If J&J is not on the table April 22, 23, would that clinic get Moderna or Pfizer?
We'd have to talk with our colleagues there to make sure that they had the wherewithal to utilize it, to store it, to get folks back in for their second doses. That's a conversation that our team would have to have with the hospital.
Okay.
Certainly open to it, as we've provided doses to them previously, provided doses of Moderna to a number of institutions, but I can't answer that right now. That's a conversation that I've got to have with them to make sure that's what they want.
Okay. And so far, how many J&J doses have been given in Maine? I know you said you heard of
51,194.
Okay.
Or so.
Okay. All right. And you said it's really unpredictable to know if someone's at risk to have a blood clot from the J&J. If someone's on blood thinner medicine, should they veer away from it?
No, this is, let's get more information, Bonnie, but this is not related to whether you happen to be on blood thinners or anything of that nature. The risk factors that may or may not exist, given that we only have 6 cases, there may not be risk factors that we can delineate or tease out. And if you are having an experience like this, you'll know about it. But whether there are predisposing risk factors that people can counsel other patients on, that's really what the advisory committee is set up to analyze.
Okay, thank you.
Over to Ashley Blackford next.
Hi, Dr. Shaw. I'm wondering if you're seeing college-age kids getting vaccinated now that they're eligible, or are you seeing some reluctancy? And if so, is that concerning?
Actually, based on the reports that we've received, and we have a liaison within the within the Maine CDC who works closely with colleges and universities across the state, we've seen really robust demand among the college university populations, that community, to get signed up for vaccines in whatever town or city they're living in. That's great. We want to encourage that because we've also seen a lot of cases of COVID on college and university campuses. So we're encouraging colleges and university students to sign up in their town. We're not doing special clinics or anything of that sort. We're encouraging them to find a spot that's in their town and sign up as would anyone else.
Thank you.
Over to Brian Sullivan next.
Thanks, Dr. Shaw. You may have touched on this at the beginning when you were explaining the 6 cases. Do you know of any other similarities between these people who had the adverse reaction, aside from the age and how long out from the shot they'd had, geographic or anything like that?
I can tell you, Brian, based on the meetings I've been in today, there is not thought to be a geographic component or a cluster geographically to these cases. They are spread across the United States. We've also asked, and again, a lot of this will be discussed tomorrow, whether any of them or all of them had another common pre-existing medical condition. Perhaps they were all taking the same medication. Those are the questions that I know are going to be discussed tomorrow. Based on the initial review that the CDC and perhaps FDA have done, those commonalities were not readily apparent, but more to come on that 24 or so hours from now.
I wonder if maybe any of you, based on your experience, can draw a parallel to an occasion where maybe the entire nation wasn't watching so closely when a pause like this was hit. But do you come out of the other side of this with maybe some new guidelines? If you have a pre-existing condition, you cannot have this, just maybe one extra box to check when you go through the sign up, or one other question to answer as you do sign up for the Johnson & Johnson once you hit play again?
So Brian, I've been thinking a lot about this. There's not necessarily a clear analog or parallel that comes to mind. And that's the reason is that this is not an atypical event in the sense that our entire system of looking for adverse events is set up to do what we are seeing unfold across the country right now in real time. But the fact is, the FDA and CDC are doing this for every single drug on the market all the time. Reports come in, and they're what's called signals. And these signals come in, and then they are taken and evaluated. And there are two types of studies that are done after those signals come in. One is to evaluate the hypothesis. That's what's underway right now. That's what's going to happen tomorrow. And then there's a subsequent level of analysis to confirm the hypothesis. That is to say, is what we are seeing a correlation or is it a causation? That's what we are seeing as a country right now unfold. This happens every single day at the US FDA as well as at the CDC. What's different now is that because of the scrutiny around vaccines, we all have a front seat to it, when in fact it's occurring all the time. That's the way our system's set up. To me, it gives me great confidence that the drugs that we've got, the vaccines we've got, every single signal, even if it's 6 people out of 6.8 million, is taken seriously.
Based on that, when those other signals have come in, when does play get hit again?
It really depends on what the signal shows, what it means. I can tell you that in my conversations today, the individuals that are evaluating this, let me say one thing. The expert advisory committee that I've referenced is an independent group of scientists, but their recommendation will be evaluated by principals at the CDC and the FDA. And I can tell you, based on the conversations I've had today, those individuals are not just focused on the risks that we've talked about, but also the fact that we're in the middle of a pandemic. And a pandemic when individuals are still getting infected and still dying. It's impossible to predict or speculate, Brian, as to what might happen with the pause or when we might go from pause to play. But I do know that the folks that are doing this are well aware not just of the risks, but also the environment that we're in right now in a pandemic. This is what they do.
Thank you.
Mm-hmm. And the final question for the afternoon goes to Caitlin Andrews.
Best, but not last. Thank you so much. I want to be clear that I understand what's going on with the Maine General and the mobile clinic. So to be clear, Maine General had enough unused vaccines for this week to cover the need at the mobile clinic and not affect appointments at its own location.
Sort of yes and no, Caitlin. Maine General is supplying 550 doses to cover the operations for this afternoon and tomorrow. As Commissioner Lambrou noted, we don't want to stress out one particular location and cause them to have a shortage or cancel appointments that they would have had for Moderna. So we're going to draw doses from different places across the state to support the operations at the mobile unit for Thursday and Friday as well. That way, we hope that there's not any particular site that gets stressed and has to cancel appointments, but rather we can balance that load across the entire state.
Okay, can you explain a little bit more where you might be looking to find those doses? And also, do you see the state looking to reallocate doses to other places to ensure that appointments stay steady?
We do that every single day, Caitlin. That is not new for us. Literally every single day, our immunization team gets a report of inventory on hand at every single vaccination site in Maine. And we also match that up with what we see as scheduled appointments. When we see mismatches between that supply and that demand, we move doses around multiple times per week. So this shift won't be anything new. That being said, what we do with that inventory on hand report, what we will do for Thursday and Friday is, again, look for a couple of doses, a couple of vials from different sites across the state that can be redirected to the mobile unit. Before we make those allocations or those redirections, we check in with the site. And if they say, we actually just booked 30 appointments, we can't make that happen, we understand that and we go to the next spot. But this movement of doses, these internal transfers, that happens every single week and has happened since December 14th.
And I will add that we feel very lucky in the state of Maine because our provider community, our clinics, our pharmacies have all had that kind of community spirit to support this. We thank Maine General. We thank all those providers who, again, every single week have said, okay, we get it. We want to make sure people get their shots. So the willingness, the support, the flexibility that our own vaccine providers in the state of Maine have had is really a testament to why we rank in the third and fourth positions in terms of the number of first doses as a percentage of our residents and and final doses that are in people's arms.
That's exactly right, Commissioner. I want to underscore that, Caitlin. When I reached out to Maine General this morning, the immediate answer I got back was, tell us how many you need to ship over to the unit and tell us who's coming to pick them up. And within an hour, it was ready to go and it was all packaged up and ready to be moved. Similarly, I reached out to some other provider groups across the state to try to start planning for the next couple of days. And every single time, the answer was, let us know, we will make it happen.
Okay, yeah, certainly understand that this movement isn't new, but I just want to be clear that I'm understanding that no other places are being asked to kind of like give up vaccines and then have to cancel appointments at their clinics. That these are all like vaccines that, you know, they may have extra from or they may not have scheduled yet that we are then moving to this mobile clinic.
Our intention is to minimize any type of cancellation. And so if a site that we reached out to said, we really can't spare those doses because that would entail the cancellation, then we'll move on to the next spot on our inventory list where we see doses available on hand. I can't promise in every instance forever and ever that we may not have to entail cancellations, but our approach is, of course, to minimize any type of cancellation. That's how we go into the discussion. Can't promise that that will always be the case, but that's how we think about it from the first stage.
Okay, I do want to follow up on that, Dr. Shaw. Does the state kind of see this mobile clinic then? Is it so important that you guys are hesitant to have to cancel any appointments at this site versus having established appointments at other sites?
No, I don't think that's how we think about it, Caitlin. We never try to cancel any type of appointment. That's why when we move doses, it's always to correct any imbalances we see in supply and demand. There's not a hierarchy in that sense of sites or anything like that. If we need to move doses, which I think we will, we always attempt to do so in a manner that minimizes or eliminates the likelihood of canceling any appointments from the site from where the doses are being moved.
Okay, and sorry if I'm just belaboring this point. I just want to make sure. So it sounds like you are confident to have enough for today and tomorrow at this mobile clinic, but you're not sure about Thursday and Friday's appointment.
We will have vaccination available at the mobile unit for the remainder of the week using Moderna vaccine.
Okay, and no appointments will need to be canceled.
Appointments were canceled this morning because of the changeover to the Moderna vaccine from J&J, and we're working with those approximately 150 individuals to try to find a time for them to get vaccinated before the mobile unit leaves.
Okay, thank you.
Governor, that was the last question for the afternoon, so I'll turn things back over to you.
Thank you. I want to say again what a pleasure it was to meet the people from the U.S. CDC, the U.S. Public Health Department, and others who are staffing that mobile unit. The people from Arkansas, Texas, North Carolina, Massachusetts even, and what a great partnership it is to have the federal government and private enterprise providing sites and logistical availability for this incredible unit. And we are so excited about continuing its mission here in Maine. This is one of only 30 across the country. I think second one in New England. So we're very fortunate to have this site, and we're going to do everything we can to keep it going. And thank you, Dr. Shaw and Commissioner Lambrew, for your continued candor. You know, when I was a little kid, when we first got a television, a black and white television, there was a show on called Dragnet. And I had a guy named Jack Webb who played Joe Friday and his sidekick, Smith. And Joe Friday would always say when he was interrogating a suspect or witness, just the facts, ma'am, just the facts. And I feel like when we started with these press briefings more than a year ago, and we started combating this pandemic even longer ago, we all said, we're going to just give people the facts. We're not going to sugarcoat anything. And that's what these people and this administration has tried to do every step of the way. You deserve the truth. You deserve every bit of the truth, no sugarcoating. good, bad, or indifferent. So I want everybody to keep the faith and stay safe. This weekend is going to be beautiful. Get outside, enjoy Maine. Campgrounds are filling up. The hiking trails are there. Fishing season is upon us. The ice is out in just about all the lakes except maybe Moosehead and Sebec. But I want to thank the people of Maine for your courage and persistence, perseverance. And thank you, Dr. Shaw, once again. And thank you, Commissioner Lambrou. We'll get through this together.
Thank you very much, everyone. Have a good day.